Okay, which of the following is the most likely diagnosis for this patient? Angiosarcoma, breast adenocarcinoma recurrence, fibrosarcoma, liposarcoma, osteosarcoma. A 55-year-old woman with a history of breast cancer, treated with mastectomy and postoperative radiation therapy, presents with a rapidly growing mass in her chest wall. The mass is painful, and its overlying skin appears discolored. Biopsy of the mass reveals atypical endothelial cells lining irregular vascular channels. Immunohistochemistry shows cells positive for CD31 and von Willebrand factor. What of the following is the most likely diagnosis here? Okay, so my mind just shoots straight for angiosarcoma, just because of the fact that it's von Willebrand factor and endothelial cells. Also, I don't think it's a recurrence because of radiation therapy helps decrease recurrence. To me, there's no other symptoms here to bring up like liposarcoma or osteosarcoma. There's no fat cell. There's no like sunburst pattern here on long bones. So it's in her chest wall. So I don't think it's anything like that. So yeah, I'm gonna say right now my current gut is angiosarcoma, and that would be my final answer.
Bingo. Great way of working through it, right? So I think you mentioned all the good things here, right? So you have somebody with breast cancer that had a mastectomy, which is surgery to take it out, and then post-op radiation, right? And so when you have that, they're giving you some kind of risk factors, right? So radiation therapy is a risk factor for other kind of cancers, but not necessarily breast cancer, right? And then after that, she had a rapidly growing mass on her chest wall. Anything rapid on a clinical standpoint is usually not good. It's painful, it's discolored, right? And then you have the biopsy, which is, remember, what most specific. Okay, so anytime you get a biopsy, you should really be zoning in on that. And you did great here saying there's atypical endothelial cell lining, right, with
Mhm.
irregular vascular channels. So in your mind, you're already thinking cancer of some kind of endothelial origin, right? And then you talked about it great, right? Von Willebrand factor and endothelium, right? Those are all kind of vascular kind of cells that line vascular structure. So yes, for sure, angiosarcoma. I do like that you kind of ignored the CD31. I don't even remember what
I don't know
CD30.
what CD31 is. I
Yep.
know CD34 is like base stem cells, and so I was like, I have no idea what that is. And so
Yep. So
yes.
for me, right, if you don't remember something, right, act like it doesn't exist, right? To me, I don't remember CD31. I can't remember a lot of the CDs, right? But like I said, you don't need that piece of information to get this answer right. So good job.
And so that's what you're saying about a lot of people could focus on like, oh, I don't know, you just rather know CD31 or you don't. And so you just kind of focus on that and
Exactly.
they okay.
Exactly.